Everybody, welcome to my channel. This is a pathology video on respiratory pathology. This is the second in the series of videos on bronchiectasis, and this covers one of its main causes, Kartageners syndrome, or also known as ciliary dyskinesias. So this is by Dr. CSBR Prasad, Professor of Pathology, Sri Devaraja's Medical College.
And coming to the individual diseases, ciliary dyskinesia, wherein the motility of the cilia is abnormal. So, under this category, immotile cilia syndrome, Kartageners syndrome are the ones which to be considered. And the ciliary beating is decreased in these syndromes, and there is decreased mucociliary clearance and accumulation of secretions in the tracheobronchial tree, and this forms a rich culture medium for bacteria, and they grow to produce infection, and this infection results in damage to the bronchial wall with abnormal permanent dilatation. So this is a normal appearance of ciliated columnar epithelium, where we can see the cilia on the top. C represents the cilia, and cross section of the topmost portions of this ciliated epithelium, wherein some of the cilia are cut in transversely and some are cut in longitudinal fashion. And you can see that there are some structures within the cilia. So if you look at the detailed structure of diagrammatic representation of ciliary structure, there are some circular doublets on the periphery and also one in the center. So these are called as microtubules, and they occur usually in doublets, and at the periphery there are 9 microtubular doublets, and at the center there is one pair of microtubules. So this gives a structure, and this also is responsible for normal ciliary motility. So if you look at the outer doublets, there are some green structures extending from each doublet, and there are 2 in number. One is on the outside and the other one is in the inside. So these are known as dynein arms, and which are very essential for ciliary movement. So in the case of genetic abnormalities involving the cilia, these dynein arms may be defective or absent, and hence the ciliary motility will be impeded. And these red lines extending from the outer doublets are the radial spokes, which connect to the inner doublets. So there are 9 microtubules with one central pair of microtubules, and these dynein arms are attached to the peripheral microtubules, and they are 2 in number, and the dynein arm facilitates movements of the cilia. So any abnormality will result in a failure of cilia to move properly. So this is the cross section of normal cilia and the cilia in Kartageners syndrome. Notice that dynein arms are absent in the case of Kartageners syndrome. So this electron microscopic diagram shows the appearance of normal cilia in cross section and the appearance of cilia in ciliary dyskinesia. Notice the dynein arms represented by black arrows in the normal cilia, and if you look at the same area, outer dynein arms are absent in ciliary dyskinesia. So what is the most common abnormality involving the cilia? Absence of either outer or inner dynein arms or defective radial spokes. So clinical features of ciliary dyskinesia: these patients repeatedly come with some infection, especially involving the ear, sinuses and chest, that is lung. So otitis, sinusitis, chest infections are commonly seen in those persons suffering from ciliary dyskinesia syndromes. In addition to that, the organs may be mal placed, that is that may be involving situs inversus. That may I will do it again. Clinical features of ciliary dyskinesia: these patients will come with recurrent attacks of infections, especially involving the sinuses and ear and also the respiratory tract. So the patient may present with otitis and sinusitis and recurrent pneumonias. They usually have malrotated structures, they may be suffering from situs inversus. If they are males, they may also have infertility as a component. These are the components of Kartagener syndrome. You should suspect Kartagener syndrome in any patient who is suffering from recurrent attacks of infection, mainly in the form of sinusitis and otitis, and coming to you with bronchiectatic features, and X-ray may reveal situs inversus in this patient. If the patient is male, probably they may also have, in addition, a sterility. And this is the X-ray appearances of radiological appearance of a baby, wherein you will see dextrocardia and left-sided liver. Same thing in the CT, and chest X-ray, chest CT image showing pneumonic consolidation involving the lung fields. And if you take an ECG, you will see in the chest leads progressively decreasing or wave amplitude from V1 to V6. In a normal person, the reversal is true. So why situs inversus in Kartagener syndrome? So cilia has got rhythmic mobility, and this rhythmic movements is responsible for rotation of organs during our development. And in ciliary dyskinesia, this rhythmic movement is absent, so organs will be placed in abnormal places, and which we will call as dextrocardia, or it may be situs inversus. So rhythmic movement of cilia are normally seen in the fallopian tube, respiratory tract, sinuses, CSF pathways, and they create a mechanical force, and during the development this mechanical force is responsible for location of the organs in normal places. So when the cilia fails to move, this mechanical force is absent, and the organs are placed in abnormal locations. The same thing. And there are certain diseases wherein cilia is abnormal and ciliary motility is abnormal, and because of this the patient suffers from some diseases. So they combine together to call placed under the category of ciliopathies. So examples for the ciliopathies include retinal degeneration, the anosmia, and renal, hepatic, and pancreatic cysts, post-axial polydactyly, and situs inversus. So you heard about the pancreatic or renal cystic disease. If you look at the ciliary movements, they are rhythmic and they are propelled towards one end of some structure. Say for example, fallopian tube, they may beat towards the uterine cavity, and in the respiratory passages, they beat towards the oral cavity. So this is the normal function of the cilia, but there is one more function of cilia, which is mechanical sensing. So this type of cilia are mainly located in the renal tubular epithelium, and they sense the flow of urine in the renal tubular system. So when there is defect in this mechanical sensors, probably the patient, tubules may not develop properly, and the patient may land in what is known as renal cystic disease, polycystic kidney disease, and this comes under ciliopathies. And there are many other syndromes which come under ciliopathies, and here this table gives the different genes that are associated with the ciliopathies and their location, and also the system that is affected in these diseases.
Thanks for watching. Please subscribe by clicking the button subscribe.